When you get to the point of saying, I'm going to get down to the bottom of this, because I know it's not normal to have stomach aches for 2 years and the doctor is not responding to that. You're challenged with, do I choose going to all of these appointments to investigate your health? Or do I say, you know what, I have to be at work, I'll deal with that later. And a lot of times when you're not getting answers consistently, that's what we subscribe to. I will deal with that later. You are worthy of more. Demand your answers. Where are the answers? At one point I wasn't committed. I was just following whatever the doctor said and just going with it and checking off the box. I went to a doctor, check. I told them what was going on, check. I got no answers, check. And that was okay. It got to a point that it was not okay anymore.
I insisted again. I had to get a second set of lab work. He did say then that something was wrong with me. I asked him what was wrong with me, and he said that my platelets were low.
We needed to know what was causing all these symptoms, what was causing her to feel so ill, but nobody was believing what was going on. And now that we knew her platelets were low, you know, she could die. Like, she wasn't leaving the hospital without an answer.
After my diagnosis, I didn't really know about lupus.
I had to learn to live a different way, take different medicines. I could barely walk. I didn't have as much energy. I was tired all the time. It was all of a sudden, my insurance company decided that they wanted me to do kind of a step-down treatment.
The way that the system works for the most part is that insurances typically don't want to pay for the more expensive but more effective treatments. So they force you to go onto the inexpensive treatments that have more side effects.
I can't fathom why somebody sitting somewhere would say, this kid, now adult, parent, father, sibling, should go off of a drug that had radically changed his life. And for dollars, like for a few dollars. I'm not like immune to the idea of dollars and cents and good business acumen. Like, I get it. These are for-profit businesses. I run for-profit businesses. But the cost of somebody getting sick with Crohn's, like running on medical bills that must be in the tens of millions of dollars.
I had a relapse that took about 6 months and 2 weeks in a hospital, 2 weeks in a acute rehab center for a total cost of about $500,000. Luckily, I had very good insurance, but this is what we're talking about when we talk about the cost to both the health system and to people personally.
Putting the interests of the profit of the company over that of the needs of the patient by putting patients on less effective medication first, especially in diseases like my own, which are progressive, it does a massive disservice to the patients.
As patients, we have not only a voice, but we also know our bodies best. We know when something is not right, and we know when something is not feeling well. We are the CEOs of our bodies, so we not only have the right to ask if something is wrong, but it's also important for us as patients to advocate for ourselves, because we know our bodies best and we know when something is not okay.
The woman who was helping me is a part of the Infusion Access Foundation, and she stepped in and she really put the ball rolling, or got the ball rolling, and got me approved for my medication. I think patients should have the right to choose the medicines that work best for them based on their diagnosis, not based on people who don't deal with this every day.
Organizations like Infusion Access Foundation, the Crohn's and Colitis Foundation do amazing amount of work on behalf of folks like me. Nobody, when they're in the midst of being sick, is reading every terms and conditions, and especially not the ones hidden on page 97 of an agreement. The IAF is standing here and saying, hey, neon light, look at this is wrong. You shouldn't be allowed to get away with this. This shouldn't be the standard way of operating. Instead, we should stop, fail first, and step therapy, and it shouldn't be allowed, because there shouldn't be a rule that says insurance companies together can tell people we want to get them sick first before we cure them. And I don't think anybody should sit in a room and try and think that the dollars and cents that they're trying to make by sort of changing my drug and not my doctor's choice drug should not be a rule. We shouldn't want as Americans to live in a country where that's the rule of law. Alone, I am the underdog. Together, we can topple Goliath.